then if I don't like my my speech, I will pause a little bit and then redo it. So you just have to connect the what's good, huh?
No problem. Yes, that's quite all right.
So if I'm looking at this view and look at the I
That is, don't look up, look down.
look down, huh? Okay,
Yeah.
look down. Okay,
Yes, that's good. Yeah, that is right. Yes.
okay.
Okay. So, shall I go with the first question? You
Yeah,
do
yeah,
have, it's only three questions.
yeah.
Yeah. Okay, so I'll go with the first question, doctor.
Yes, yeah, Tilini.
Why is periodontal disease so important to treat in my pet?
Yeah, periodontal disease is the most common disease in pets. Yeah, this can be treated or reversed in an early course of dental disease. Otherwise, this can lead to gingivitis or redness of the gums, tooth loss or decay, and even bone loss. That is why there is a stinky breath. Most of our pets hide their pain and discomfort with toothache or tooth pain. Most will still eat and drink normally. I can tell you how many times we have cleaned and treated pet's teeth or pet's mouth, and owner will tell us that the pet is happier at home. They're eating and drinking well and playing more. And most importantly, they no longer has a stinky breath. Periodontal disease, if left untreated, this can lead to other health issues due to the fact that there's a lot of bacteria in the mouth and it can enter the bloodstream anytime, causing infection, chronic pain in the mouth, heart, lung, liver, or kidney disease, and even cancer.
Okay, doctor, let's move on to the second question. What can I do to
Do we
prevent
have,
it?
we're okay on the first part?
Yes, if you're okay with the, okay, right. So let's move on to the
Yes, okay.
second question. What can I do to prevent it, doctor?
Please remember that once your pet's periodontal disease has reached moderate to severe level of dental disease, any OTC will not help your pet's mouth. Yeah, there are options you will want to pursue once your pet's mouth has been cleaned by your veterinarian. These options will not get rid of the existing periodontal disease your pet may have. Here are the various over the counter options you can do to prevent it. Number one, brushing your pet's teeth at least 3 times a week. Number two, you could give some dental chews such as Orovet or CAT chews. Number three, you could give some cleansing that you can sprinkle over the food. You could also give dental treats, and um, and there are also some products that you can mix with the water, like chlorhexidine. There are also a MaxiGuard gel or spray that you could rub and spray on your pet's mouth. Just remember that your pet's mouth should be examined at least once a year by your family veterinarian. And with that information, we can both come up with a plan for prevention that works for you and your pet. Okay, we could go to the. Are you okay on that, or you want me to repeat anything? So we could go to the
Yeah,
last.
just give me 1 minute, doctor. The last bit I couldn't get. It
Okay,
didn't actually come because, hold on.
yeah, we could repeat it if just tell me
So
the.
shall we do second question again, if you don't mind, because
Sure, no problem.
didn't.
Yeah,
Okay,
no problem. You want me
okay,
to
great.
start now?
Just a minute. Let me ask the question, and then you can.
Okay.
What can I do to prevent it, doctor?
Yeah, please remember that once your pet's periodontal disease has reached moderate to severe level of dental disease, any OTC will not help your pet's mouth. There are options you will want to pursue once you have your pet's mouth examined by your family veterinarian. These options will not get rid of the periodontal disease your pet may have. Here are the various options that you could do to prevent it. Number one, brushing your pet's mouth, or okay, let's repeat that. um, Here are the various over-the-counter options you can do to prevent it. Number one, brushing your pet's teeth at least 3 times a week. Number two, give them dental chews such as Oravet or CET chews for cats. Number three, you could give Cleansadent that you can sprinkle over the food. Number four, there is dental treats that you could offer on a daily basis. Number five, there are products that you can mix with the water like chlorhexidine. And there's also MaxiGuard gel or spray that you can rub and spray on your pet's mouth. Just please remember that your pet's mouth should be examined at least once a year by your family veterinarian in conjunction with a wellness exam. With that information, we can both come up with a plan for prevention that works for you and your pet. Is it much better, or you want me to try?
Okay, can I go with the third question, doctor?
Okay, yeah,
Okay.
yeah. It might take a couple of tries on this third question because they're long. But again, we could do it segment by segment. If you don't like the paragraph, we could yeah redo it.
No, that's quite all right. You once I ask a question, you give the reply to it, and if you think it is not good, we can do it again. Don't worry.
Yes.
Okay, great. Okay, so shall I ask the question and then you can give the reply to that?
Yeah.
Okay, great. Can you explain to me what happens to my pet when I bring him or her in for a dental cleaning, doctor?
Yeah. Since we are an AHA accredited veterinary hospital, we will go above and beyond what is required by the state board. I understand that anesthesia can be scary for owners, but here at Bloomfield Animal Hospital, we do everything in our power to ensure that your pet has full anesthesia recovery. This is how our dental procedures go. First, you must bring in your pet in the morning. The receptionist will check you in. and have you sign all the consent forms that are required. You will leave your pet with us for a day. My staff will call you after 3 p.m. to let you know the time you can pick up your pet. Once you leave your pet, we will get our pet's vitals, which is weight, temperature, pulse, respiratory rate. Then we will draw the blood for an pre-anesthesia panel. This will allow us to ensure your pet's organs like kidney, liver are working well and be able to stand the anesthesia. After that, we will run an ECG that will send this to IDEX cardiologist. This allows us to make your pet's heart healthy. Well, let me redo this one. This allows us to make your pet's heart is healthy. Once we receive these results, I will review them. If I find any concerns in either one of these tests, I will call you and discuss let me redo it. Once we receive, let me see. Okay. Once we receive this test, I will review them. If I find any concerns in either one of these tests, I will call you and discuss our options. If everything is fine, I'll do comprehensive exam on your pet. Once the pet is cleared by myself, then we will give a pre-anesthesia sedative and put an IV catheter. Once your pet is fully anesthetized, we'll give a warm IV fluids. And my nurse once your pet is fully anesthetized, warm IV fluids are started. One of my nurses, who has been fully trained by a dental specialist, will begin scaling your pet's teeth. At the same time, there is an anesthetic nurse monitoring your pet during the whole procedure. We're monitoring your pet's breathing, heart rate, oxygen levels, and blood pressure. Once the technician finishes the scaling, then we will chart your pet's teeth. Charting is very important for me to see if there is any gum erosion or pockets at the root. Once the charting is finished, she will polish the teeth. The procedure that I have described is almost exactly what is done to you when you visit your dentist and have a teeth cleaning done. So once the mouth is clean, then we will take a dental x-ray. This is a full dental x-ray. That is important due to the fact that it allows me to see the teeth roots and determine if any extractions are necessary. If extractions are necessary, then I will proceed to do that. I use the same instruments that your dentist uses. After the procedure is completed, the vet will, let me redo that. After the procedure is completed, the pet will, let me redo it again. After the procedure is completed, we will turn off the gas anesthesia and have your pet recover. Well, I don't like that. After the procedure is completed, the pet will be taken off anesthesia. This whole time, the anesthetic nurse has been by your pet's side, monitoring and will continue to monitor until the pet is fully awake. One of my staff will call you in the afternoon and let you know what time your pet can go home. Once you arrive, I'll show you the dental x-rays and explain you Let me do this last part. Once you arrive, I will show you the dental x-rays that were taken and explain you in detail what was done and reason behind it. I will answer all your questions that you may have. Please allow at least 30 minutes for the discharge. That's it. Do you want any redo some part?
If you're okay with that, then with with the little parts that you read it, I can always edit and put it together. So that's okay.
Yeah, yeah.
Yeah. So
That's why
I
that's
can
why I pause. Then that way you have time to cut it and
cut it, and yes, exactly. But I have another question, because while you were reading that, I think shall I just ask you this question, doctor?
yeah.
How long does this procedure take?
Oh, how
I
long?
would ask it, no, I would ask it like this. How long does this procedure take, doctor? And is there any pre-preparing I need to do with my pet? Is that question okay?
Oh yeah. Let's see. The procedure usually take.
No, I haven't still asked that question. I will ask that question and then you can reply to it. Okay?
Sure.
Okay. So if you're ready, I will ask the question and then you can reply to that.
So let me read your question is how long the procedure takes, right?
Yes. And is there any pre-preparing I need to do with the pet?
Oh, like preparation.
Yeah, preparation that I need to do with the pet.
Yeah. Usually the preparation is like no food after 8 p.m. the night before. We usually tell them. Yeah, we usually tell them before they schedule it.
Okay.
Yeah. Do you think that answer your question?
Yes, that would be great. But let me ask the question, then you can give the reply to that.
Okay.
Okay, so I will go with the fourth question. How long does this procedure take, doctor? And is there any preparation I need to do with my pet?
Yeah. Usually the dental procedure take at least an hour to maximum 2 hours. Yeah. The preparation usually you don't give food after 8 p.m. the night before. You don't give anything in breakfast, nothing by mouth, no water, no food.
Okay,
You want
great.
me to rephrase it?
Uh, okay, no, I was thinking you would phrase a little more on the
Yeah, okay, yeah.
preparation, on the, sorry, on the procedure, because you were talking about keeping the pet overnight and things like that.
Oh, no, 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 we don't. Oh, okay, we don't keep them over. Okay. Usually I discuss it, I discuss that on
Okay.
the third part that, drop them up in the morning and the pick up in the afternoon.
Oh, okay. Okay,
Yeah,
great.
it's those are already been discussed.
Okay, okay. Yes, you have already told that, yes.
Yeah.
Okay, so the four questions are okay with you, right?
Yeah, yeah, yeah. The fourth question,
Great. Okay.
unless you want to rephrase the preparation. Is that Are you okay with this preparation?
No, that's okay. Yeah, that's okay. That's okay. Because the viewer would like to know, briefly what is really going to happen. So that is what we should give from the video. So we have already done that.
Yeah. Anyway, anytime we could, we could
Yeah, we
repeat
can
it.
do another one,
Just
definitely.
let me know. At
Yes.
least, we
So
are
this
working. This is a good start, so we could do more.
Yes, exactly. We can do more. Exactly. Yes, you can always. I think you're in touch with with.
Laura,
I'm not quite sure whom do you speak to? Is it?
Laura.
Oh, okay,
Yeah,
okay. So
we'll speak with Laura.
Laura, okay. So you can always speak to Laura, and then if you want another video done, you can always tell her and the subject as well that you want the video to be done in, and we can
Yeah,
do it.
Melissa wanted to do orthopedic
Oh, okay, okay. So you can always tell her, and
orthopedic
then
surgeries procedures.
exactly, yes, because that would be very interesting for the viewers, and when it goes onto your website and things like that, everybody would like to have look at a video better than just reading things.
Yeah,
So
and
that's
later on
why.
we will supplement that with with pictures of the dental.
Exactly. Yes.
Yeah, we'll send you
Yes.
some pictures once we have some good dental pictures on our own. Yeah, I wish we
Yeah.
could do this every month.
Yes, why not? If you have a subject, we can do it. Yes. There's no problem at all.
Yeah.
So thank you, doctor, and
Thank you
I
very much,
will,
Eleni.
yeah,
Hopefully,
I
this
will
would make
give
it
this.
more,
So
beautiful.
yeah, what will happen is I will give this to the team, and they will edit the whole video. And once it's edited, they will send it for your approval first. And once you give your approval, they will go live with it.
I'm scared. I'm not, celebrity.
No, that's quite all right.
I'm not good with it.
No, you were quite all right. Yes. Thank you very much, doctor.
Thank you,
Okay, have a good
Eleni.
day. Have a good day. Bye bye.
How come I didn't see your picture?
No, you can see only the DCA logo.
You're hiding.
Yes, I am. I'll see you, doctor.
It's
Bye
unfair.
bye. I will see
All
you
right,
then. Bye
Eleni.
bye.
Nice talking to you. So I'll
Nice
talk to you
talking to you
later.
too. Yes.
Okay,
Bye
bye
bye.
bye.